Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to go over a handful of exercises that are really good to start at about week 2 after your knee replacement surgery. Before I jump into that, hit that subscribe button, turn on the notifications to catch all of our latest videos. So these are definitely not all inclusive, but just a handful of different exercises that I'll usually start with patients around week 2 or 3 after surgery. So the first one we're going to do is bridging. You're going to lay on your back with your legs bent up, ideally side by side. If you're having some range of motion limitations still in the knee, which is very common, still week 2, you can keep that leg out a little bit further so you don't have to bend your knee quite as far. And then all you're going to do laying down is you're going to lift your hips and pelvis up toward the ceiling. And then back down. Bridging is a great exercise for your hip muscles, so strengthening of your glute muscles. Also engages your core and abdominals a little bit for some core stability. Also gets your hamstrings activated a little bit. If you do have some stiffness or start to get some cramping in your hamstrings, think about squeezing your butt muscles, squeezing your glutes as you perform the bridging to hopefully help alleviate that. And if you feel some back discomfort, try to think about doing that posterior pelvic tilt and holding that activation of your core. So again, legs bent up, try to do that pelvic tilt. So try to flatten your low back against the mat, feel your belly button tuck in a little bit. And then as you lift up, try to squeeze your butt muscles and then slowly and controlled back down. Usually do about 10 to 15 repetitions in 1 to 3 sets. The next exercise is also really good for your hip muscles, strengthening your glutes. As you'll notice, we don't just focus on the knee itself. We really want to maintain good strength and stability throughout your leg muscles, so your hips, your core, your abdominals. Really important to maintain good strength for function and mobility and activity tolerance. So laying on your side, and I recommend doing this on both sides, so strengthening the surgical leg and the non-surgical leg. You may have already been doing clamshells, lifting up like this. This one is a little more intensive. We're going to do side lying hip abduction, so side lying straight leg raises. So usually I like to bend my bottom leg just for a little bit of stability of the pelvis. And I like to put my hand right on the top of my pelvis here. And you're just going to lift your legs straight up toward the ceiling and then back down. A common compensation is to start to flex that hip and the leg starts to come forward. Try your best to keep your leg in line with your torso, and that way you're getting the strengthening coming from your gluteus muscles rather than your hip flexors as a compensation. This is going to be a little bit harder than clamshells because you're lifting your whole leg up against gravity now. So it takes a little bit more strength. Ideally, you want to work up to do about 10 repetitions at a time, and again, 1 to 3 sets. So now we're going to transition, and I'll show you a couple exercises you can do in a standing position. So this next exercise is a more standing dynamic exercise, which as we progress in your rehab and recovery, we really want to start to incorporate more dynamic, functional, standing type movements and exercises. One thing that's particularly challenging after a knee replacement is getting back to quote unquote normal walking and moving. So I like this exercise because it starts to work on that, work on your walking, work on your strength, your mobility. So all you're going to do is stand with some sort of upper body support. So I have my hand against the wall. Ideally, you can stand with your hand against the kitchen counter, holding onto the sink or a sturdy table or piece of furniture. And all you're going to do is we're going to do some steps in place. And what it's going to look like is you're going to take a big, large forward step, and then you're going to take a large backward step. So we're not going to stop in the middle. We're going to go from forward straight to backward, and vice versa. So you're taking big forward steps, big backward steps. So this is working on your step length. It's working on the amplitude of your movements, working on developing a little bit of power as you step through. So I like to do 10 to 15 repetitions, turn around, switch sides, and do the other leg. So doing it on both the surgical and non-surgical leg, because of course as you're walking and moving, you have to use both legs. So that's just forward and backward steps in place. And then the last thing I'll show for today is we definitely want to start to incorporate some balance, coordination, and stability into your rehab and recovery. Some people obviously more important than others, but I would argue some of it is important for everyone. So what I like to do, standing with some sort of support, ideally for you it would be your kitchen counter, something a little more sturdy than a chair. And one thing we can do is just try to stand in a heel to toe position. And holding on, maybe fingertips to start, but try to get where you can let go. See if you can hold it for 30 seconds. And then reverse and do the other side. See if you can hold it for 30 seconds or so, and then relax. So that's tandem balance. You can do a semi-tandem or a modified tandem where you're not necessarily heel to toe, but you have one foot a little bit in front of the other one. So if you're not quite able to do the tandem stance yet, then try heel to toe. And what you can also try is single leg balance. So again, being close to that sturdy surface, go on to the one leg, and see if you can let go and hold it for 10 seconds. And then again, be sure to perform that on both sides. Working up to maybe doing 3 to 5 repetitions, holding for about 10 seconds each. So again, this is very static, very basic balance. But what you'll notice is that week 2 after surgery, this might be quite challenging for you. So it's a good starting point to start to work on some balance and coordination, and then progress that to more dynamic, more functional movements as your rehab and recovery progresses. So that's just a couple of exercises that I would probably start to incorporate around week 2, maybe week 3 or 4 after knee replacement surgery. I hope you found this video helpful and insightful. As always, please be sure to leave your questions and comments. Please be sure to hit that like button. Thank you for watching.